This is Deborah Atkinson, and you're listening to Flipping 50, where I address your top questions and struggles. I share what to eat and how to move and how to think so you can get the energy and the vitality you want in this second and better half. And my guest today is returning. So Dr. Joe Tatta is a good friend of mine, and he teaches you how to retrain your brain and body so you can live the joy-filled, pain-free life you deserve. He's a doctor of physical therapy, functional nutritionist, integrative pain expert, and #1 best-selling author of Heal Your Pain Now. He's known for integrating neuroscience, nutrition, psychology, and movement into simple treatments for lasting pain relief. Dr. Joe's mission is to quickly, compassionately heal your pain and reverse the global pain epidemic. You can participate in the conversation weekly on Dr. Joe's Healing Pain podcast or experience the benefits of working with him by joining Heal Your Pain, Heal Your Life, the integrated pain relief program online. We're talking today about pain. We actually have here on Flipping 50 for the last few weeks, and I wanted to bring Joe back because as I've addressed this, we've talked a little bit about it. If you're listening in the current time, May was just Arthritis Awareness Month, and it brought up a lot of response from all of you listeners and subscribers. So Joe, thanks so much for being here with us.
Hey, Deborah, I'm so happy to be here for this encore presentation.
So pain is such a downer, all right, for us to talk about. But I think you're going to leave us all with some hope and a new way to think about it. And it's been a while since you and I have talked, but, you know, what does the brain have to do with pain, first of all? Because I know that's your approach. And pain is not necessarily what we all have been used to thinking of pain as.
Yeah, the brain and pain is a great place to start, and it'll open up a lot of doors for people as far as their thinking, because we know that the more knowledge you have, the less likely pain is to be intense, or the less likely pain is to continue. When you start talking about Arthritis Awareness Month, I think about the millions of people who have osteoarthritis primarily, and no doubt, if you have a diagnosis of osteoarthritis, you have gone to see some kind of practitioner who has taken an X-ray or maybe an MRI, and they've looked at your knee or your hip or your spine, and they've said, you've got a lot of wear and tear in there. The cartilage is degenerating. The joint is breaking down. And I'm not really sure how long this knee is going to last or how long this hip is going to last for. Now, that type of view toward pain is what we would call, about 50 years ago, a mechanical approach to pain. And a mechanical approach to pain is necessary. It's needed to heal pain, but it's not the only factor that we look at when we try to help people with chronic pain. Now, if you think back, or people can play back this podcast and listen to some of the words that I used. Wear and tear, breaking down, degeneration. Sometimes you hear things like crumbling or, cracking. Those type of words are extremely what's called noxious or extremely harmful, and they elude a sense of danger. When the patient hears those type of words, automatically they get sensations of anxiety, their fear increases, and with that, the brain kind of turns on. It lights up like a big red light bulb, and it starts kind of ringing an alarm. Now, if you think about a ringing alarm, like when there's a fire, that ringing alarm is that danger signal. It's an alert. It's meant to kind of make you pay attention. With chronic pain, what happens is that danger signal continues for longer than it really should. So it's really, to kind of summarize that, it's really less about what we actually see in the joint. It's really more about how the person is perceiving what's really happening to them. The flip side of that is if someone goes to a physician or a practitioner of any kind and says, well, your x-ray shows that you have some arthritis, but an image is only a small percent of your pain experience. How you perceive your ability to handle the situation, what tools you have in your arsenal to help with your pain, the practitioners on your team that you've constructed to help you. And then, really last but not least, all of that really points to someone's self-efficacy. And that's a really fancy word, but self-efficacy means, do I have the ability to overcome the obstacle in front of me? So when we talk about the brain and pain, the take-home message is that chronic pain is not just about the body. It's really a mind-body problem. Out of all the problems we have in healthcare, chronic pain is probably the most beautiful representation of a mind-body problem, and that's the way we have to treat it.
So let me summarize in my words and tell me if I'm on point here or not, okay? So kind of thinking about, as you're talking about the emotion, it's actually the emotion that we have to the actual diagnosis. It's not actually the emotion even about the pain in that specific joint necessarily. Am I correct?
That's right. Someone's emotional response. So an individual's emotional response can intensify or decrease their pain. So if you go to a practitioner and they say, you got some arthritis there, I think this knee is going to last about, maybe one more year, then you'll have to have a knee replacement. That emotional response can make pain intensify almost instantaneously. Conversely, if you go to a practitioner and say, well, you have a little bit of arthritis in there. However, we know that movement is like motion, or movement is like lotion for a joint. So I'd like you to start exercising in a way that makes you feel good, in a way that you can do a couple times a week, that'll improve your mood as well. Those are two distinct situations. Those are two different experiences that a person can have. And we know this. We have studies where two people have the exact same amount of arthritis in their knee, or two people have the same herniated disc in their back, but yet the emotional experience that they're having, or the emotional experience they've been exposed to, can intensify their pain.
That's wild. Okay, so let me ask you this. I can't necessarily control what comes out of the doctor's mouth. So short of changing my doctor, what can we do to change our response?
The most important thing that anyone with chronic pain can do is empower themselves with knowledge. And that's why a podcast like this is so important, because it's me and you, two practitioners, basically piecing our way through what we currently know about pain. Now, like you said, so often, Deborah, when patients come to me, they've been to, 2, 3, sometimes 5 physicians. So they already have a lot of ideas in their head. So it's really just sitting down with your client or your patient, and then really explaining to them what the difference between acute pain versus chronic pain is. Because acute pain is about tissue damage, where chronic pain is about an overly sensitive nervous system. Those are two very different things. Tissue damage can be the muscle or the tendon or the ligament. That heals usually within about 12 weeks. If the pain continues beyond that 12-week period of time, it's chronic pain. And that is because the nervous system, or the nerves in your body, as well as your brain, because your brain are your nerves, has stayed sensitive, has stayed turned on for some reason. And then you start to piece through and you say, okay, in your particular life, in your particular instance, what are the factors keeping your nervous system kind of hypersensitized? So do you have a lot of stress in your life? That's really the biggest question.
Yeah.
And stress in and of itself can be broken down. Do you have financial stress? Do you have work-related stress? Do you have stress in the home with relationships? Did a particular explanation that a provider gave you create stress? Because the stress-pain connection is so intimate. Anytime there's pain, there's stress. Anytime there's stress, there's pain. Those two often, it's that bidirectional relationship. And just opening a client up to some of those ideas, they can say, okay, maybe I need to focus on my sleep a little bit better, because obviously sleep is a great way to rest and restore. Or maybe I need to go a little bit deeper into my meditation practice. Or maybe I need to look at my social circle and say, hey, these 3 friends, when I'm with them, I feel really good and supported. And these other 2 friends are toxic and they're really not helping me in my life. So there are a lot of different levels to the stress and pain relationship when it comes to working with patients.
I love that. And I want to pull something out. You just said something about sleep, because we know that's so important. Talk about the relationship between sleep and pain. If you're sleep deprived.
Yeah, if you're sleep deprived, if you have pain, chances are you'll be more sensitive if you're sleep deprived. Why is that? There's a number of different hormones, serotonin being one and melatonin being another. Both of those hormones are often produced during sleep, melatonin being the primary one, and they really help desensitize you to pain. So if you're not getting at least 7 hours of steady sleep, which is oftentimes a big problem for those with pain, because pain can oftentimes wake them up at night, it's something that needs to be addressed. And there are, some simple ways to address sleep, and then there are, more complex ways. I just had this discussion a couple of days ago with a representative from the American Physical Therapy Association. I did an interview for them, and he said, what's the number 1 and number 2 things you look at when it comes to sleep? The first question always is, are you falling asleep and are you staying asleep?
Yeah.
The second question is, do you have a sense of choking while you're sleeping? Or if you're sleeping next to your partner in bed, do you feel like, can you hear them does it sound like they're suffocating or choking? That leads to some kind of obstructive pulmonary problem. And oftentimes in the pain population, it's because they're overweight or obese. And just the amount of weight alone on your chest can constrict your airway. And the third question is, do you have restless leg syndrome or sensations of ants crawling on your skin or muscles twitching? Restless leg syndrome is a definite sign of a hypersensitive nervous system. So those are 3 key questions that people can reflect on their own, or a practitioner can, put into their evaluation of a patient with pain.
So good. Those are great questions. And I think just listeners, a great reinforcement, again, for the benefit and the need to prioritize sleep and looking for ways to do it. So coming all the way back, circling to early on, you said, what we know, the good doctor that you were said, we know motion is lotion. So getting some exercise that you feel comfortable with would be your recommendation. What if we've got listeners who are, knowing they want to exercise, even would like to, but they're scared because of the pain?
Yeah. It's completely normal to be scared. That's the first thing. Just, open up to, I think all of us need to open up and realize that pain is scary. Pain causes fear. People are terrified to do just a daily activity or do an exercise program where it may cause them to have more pain. So these things have to be approached very gently. If anyone's listening to this podcast, they know that when you exercise, your muscles get stronger. When you exercise, your muscles become more flexible. When you exercise, you're able to do your activities of daily living more. 90% of the people on this podcast, that message has landed with them. What they're really saying is, I understand that, but I can't get there because I have pain. The best way to try to reframe that for them is the right amount or the right dose, because I really want people to look at exercise as medicine. The right dose of exercise will calm your nerves or calm your nervous system. What that means is if you go out and let's say you go for a 1 mile walk. And after that walk, you had pain. All it means is that you took too high of a dose of exercise that day. What that also informs you is that you now know that 1 mile is too much, that I need to decrease my dose, just like you would decrease the dosage of a medication. You may need to start at, let's say, a half mile. If you walk for a half a mile and you feel good afterwards, then a green light should go off kind of flashing and say, Great, I found the perfect dose. The next week, if you do, let's say, 0.75 miles, maybe you're a little bit sore. I mean, you have muscle soreness, but that's okay. So I tell people if you feel muscle soreness in kind of the meaty parts of the muscle, that's normal. Soreness is okay. Again, that green light goes off, and you know you've given yourself an adequate dose of exercise to help yourself. If you do that week after week, a walking program is kind of the easiest example to use. Week after week, you'll be increasing that dose, and your nervous system actually recalibrates itself. And it says, okay, I can now move from 0.5 miles to 3/4 of a mile to 1 mile, then 1.5 miles, then 2 miles. You can do that with any type of exercise. So if it's a 5-pound weight, you can go from 5 to 7 to 8 to 10. If it's a yoga class, you can go from a gentle flow class, then to a beginner class, then to an intermediate, then to an advanced. So working with someone who understands prescription exercise is super important when it comes to calming the nervous system.
So good. So good. Gosh, I love that analogy. I mean, exercise is medicine, that program that we've heard so many times, but I have never heard someone say it so eloquently the way you did, that, it's just like any dose of other medicine they might take. It may have to be adjusted up or down. And so if you're listening and you've tried it and you've taken a little bit too much, come back. Just don't come back quite as strong. I love that.
Can I add 2 more layers to that discussion?
Please. Yeah.
So the first layer is we know that the right dose of exercise decreases the sensitivity of the nervous system. And when your nervous system decreases in its sensitivity, your pain is better. The second aspect is about 50% of those with chronic pain struggle with either anxiety and or depression. If you look into the clinical research, the hard data behind what is the most effective treatment for depression and anxiety, hands down in any study, against any,
wait for it,
against any drug, against any anything you could go to a psychologist for, it's exercise.
Mm-hmm. Love it.
In study after study after study, in large what are called systematic reviews, a gentle, moderate amount of exercise beats any type of antidepressant medication, beats any type of anti-anxiety medication, beats any type of cognitive behavioral intervention. Now, why is that? Because when you exercise, feel-good endorphins and natural opioids are released. When that happens, your mood improves. When your mood improves, that calming of the nervous system happens automatically. So that's kind of level 2 to that. Did I have a level 3? Did I say there were 3 things there?
You didn't, but you can. It's not too late.
I got really excited on the second one there.
I know. We could repeat that.
No,
we could just play that again. I like that one.
So the third one is this. The third one is that people look at your muscles just as this like contractile tissue that contracts and releases. Some of the newest data around muscle physiology is that your muscles are its own endocrine organ. So your muscles have the ability to release its own hormones, if you will. And they actually have their ability to release its own anti-inflammatory hormones. So we've heard how important anti-inflammatory diet is. But the flip side of that is when you move your muscles, it naturally releases natural anti-inflammatories.
That's craziness. I love that.
So that's your 3-step approach of really why exercise is super important when it comes to alleviating pain.
Okay, so let me come back to that. So very much, drawing the analogy to the dose response. What about that as far as we know, you've just clued me into the fact that muscles can release their own anti-inflammatories. Is there a point of you go too far and that's not true? Is there a sweet spot? It's kind of not too little, not too much. Are we looking for the Goldilocks?
We are. We're looking for, that middle point. we say slow and steady wins the race, or you can be sore and still be safe, meaning you can have a little bit of muscle soreness. That's normal. But when, Deborah, when you and I exercise, I actually went to the gym yesterday and did probably more of a workout than I've probably done in a long time. And today I'm sore. My quadriceps are sore, my biceps are sore, my shoulders are sore. But I know that it's just muscle soreness. My brain, I know that because obviously I'm a clinician, but my brain knows that. There's not a moment in my brain where it thinks, maybe I tore a cartilage, or maybe I irritated my disc, or maybe I, tore a tendon or a ligament. My brain just knows that it's muscle soreness, which means I'm safe. If I went out and ran a marathon right now, which I'm not prepared to do, I probably would have so much soreness that my brain would really say, hey, this is more soreness than you had because you did more activity than you should have. Maybe you injured something. So there's that little question in my mind. And, if you've done something traumatic, obviously, like if you've had a fall or been in a car accident, or you went and ran a marathon when you shouldn't, and you've been sore for, over a week, then obviously you go to a practitioner and you get it checked out just to make sure you haven't damaged yourself. But for most people, they really should learn how to have that little litmus test for yourself. And if you're working with a personal trainer or another exercise professional, it's something to sit down with them and say, hey, let's lay this out on paper so we can look at it together, so we both know what our expectations are. And week by week, we can monitor really what's going on. I think one of the biggest challenges I find with people who are starting to exercise is they start to pull from this smorgasbord, if you will, of all these different exercises. Mm-hmm. And no one's really saying, hey, that is actually a very advanced exercise, and we should really wait maybe 4 weeks before we try that. The brain is really paying attention. And if it's saying, wow, this is a lot more than I'm used to doing, it may, like we said before, ring that red light, ring that red bell, and say, okay, here's pain. Pain is just a way to let you know that you've just done a little bit too much.
Love that. That's a great analogy too. And I wanted to ask you this. So I was thinking about how I can ask you this without backing you into a corner, but I might just ask, and then you can tell me if I have. Do you have exercises that are you're feeling I would rather not see people do this because of maybe repeatedly you're seeing people land in your office because they've done that? Or, I hate to say contraindicated exercise because I know very often you probably, and I definitely believe it's how you do things as opposed to what you do. But I mean, do you have any that are kind of blackballed? I really don't like this, or is that an area you want to go into?
It's a really fantastic question you ask, because so often we're focused on what not to do. Specifically when it comes, because of course we're talking about this in the context of chronic pain.
Right.
We're not talking about acute pain. So we're not talking about you stepped off a curb and you twisted your knee. What exercises should I not do for my knee to injure it? That's not what we're talking about here. We're talking about people with chronic pain. And think about it this way, Deborah. If you tell someone, I don't want you to do a lunge because it's going to hurt your knee, or it could potentially hurt your knee. What kind of signal did we send to someone's brain?
Yeah.
We sent a really large signal of danger. Instead, what we want to say is...
And not accidentally, is there a siren in the background? Did you? that was good timing.
That wasn't planned, but it's a really great... it's really great for this podcast. Think about the message we sent to someone. So instead we might want to reframe it and say, lunges are a great way to strengthen the legs. Let's try a lunge. How does that feel? It didn't feel so great? Okay, let's try a supported lunge where you're holding on to maybe a table or a chair or a piece of furniture or a piece of equipment in the gym. How does that feel? And then someone may say, yeah, with a little bit of support, I can do that. Now, the question we start to ask ourselves as professionals is, was it the actual physical support that made that exercise less painful for them? Or was it actually that they just felt more comfortable, their confidence level increased, and the brain just said, okay, we can do this exercise now? Does that distinction, is that clear for you?
Very clear. Very clear. Yes. And I'm thinking this is a podcast I should share with my fitness professionals as well. Yeah, that was
it starts to bring in what I look at as, or what I call psychological flexibility in motion. So it's looking at how psychology applies to movement, especially in the context of someone having pain. So the question we have to ask ourselves is not so much what should we tell our patients not to do, but how we can effectively coach our clients into doing more in a way that opens them up and says, hey, I actually like exercise and I actually want to do it more. It makes me feel better.
Mm-hmm. And for our listeners, if you are, and quite often I will get this, somebody's coming to me and I'm usually not the first rodeo. They've tried other things and they've had, a negative experience. And so they are a little reluctant and have a little fear maybe from that prior experience. But if you're out there and you're thinking to yourself, I can't do lunges because of blah, blah, blah. How might a listener begin to do really what you just did in a way that a practitioner could begin to rephrase that statement in their own mind?
The best way to rephrase that statement is, I'm learning how to make my body stronger. I'm learning how to overcome my pain. I'm learning the skills that are necessary to overcome my pain or to live beyond my pain. Starting with that versus these are the things I can't do. If you just focus on the things you can't do, you're really in a dead end alley, and there's really no way out of the alley. Instead, focusing on what you can do is the best way to go. The other thing, Deborah, is if it's, we'll try to talk to both clients here as well as those with pain, is first tell me what you value in your life. I want to know what's important to you in your life as far as your life goes. Is playing with your grandkids important to you? Okay. Now, when you play with your grandkids, let's look at some of those motions. Let's break down those movements. What do you have to do? You probably have to bend down. You probably have to squat. You probably have to have a sufficient amount of leg strength to do that. So keeping in mind that the end goal, what you value in life, the things you love, those grandkids are your goal. It's not lifting 20 pounds. It's not being able to squat 2 sets of 10. It's those exercise and movement are the activities that lead you toward your values in life. And when you can hold your values in mind, instead of, quote unquote, being stronger, oftentimes people are more likely to be compliant and to continue with an exercise program, especially when they have pain.
That was powerful as well. So I think, that's kind of the next step. Again, you said, as opposed to saying stronger. And, for a lot of trainers, that's progress, saying be stronger as opposed to being skinnier and off the scale is where they've come to. So they've gone to a little bit more positive way of thinking. But, even more so is how does that relate to my life and how do I live better because of it?
That's right. The truth is, none of us, in our day and age, none of us really have to move. We could probably, especially if you live in a city like New York, you can literally sit on your couch and have everything delivered to you. Everything from food to your groceries to healthcare can come to your door, everything. And for someone with chronic pain, it's very difficult for them to get motivated and to say, yes, I want to, go to exercise twice a week or 3 times a week with a professional. If you approach that person and say, what is valuable in your life and what's been missing since you've had pain, it gives them a very different road to travel down. instead of one where they're just looking at increasing the weight from 5 to 10 to 15 to 20. Instead, if they can say, yeah, this week I walked to the park with my granddaughter and I pushed her on the swing. Or this week, my husband and I were able to walk on the beach. I haven't been able to do that in a long time because of my knee pain. Those are very different values-based goals that can really help someone stay motivated.
Such a good image as well. Love this. Okay, hardest question of the day.
Uh-oh.
I know, right? You've given us so many pearls of wisdom, but is there a question that we missed? Joe, is there a question I should have asked you?
Is there a question you should have asked me? I would say the question I think for all of us to reflect upon is, what do we all need to do as individuals, as part of a society, to help people with chronic pain? Because we're looking at about 100 million Americans out of about 300 million Americans that have chronic pain. So this is a problem that all of us need to just be more aware of and think about how we can actively participate and help people overcome their pain for the long haul. Because if you have someone with chronic pain in your home, or you're married to someone, or maybe they are a coworker or an employee of yours, you realize that chronic pain really permeates every aspect of someone's life.
Great way to end the show. Thank you so much for being here, Joe. And I know you have a little something for our listeners. Where can they find that?
I have a pain-free living guide. So you can find the pain-free living guide on the homepage of my website at www.drjoetatta.com. And of course, I think you're going to include the link for everyone in the show notes, Deborah.
Absolutely. So if you're walking, of course, you probably are walking, or you're lifting, or you're commuting. We've got you covered. It'll be in the show notes, so you can just click on it and you'll be good to go. Joe, time flies always with you. Thank you for so much. I'm hopeful. I'm so much more optimistic about just how to deliver and watch my own words during my own workout about what I'm saying. Yeah.
Thanks so much.
Listeners, if you have a question you'd love to ask me or love to ask Joe, leave it below the show link at flipping50.com. I love hearing from you. And if this episode was helpful, please leave us a rating in iTunes and then share it with a friend. Surround yourself with a positive, supportive community of women on the same journey. What are you waiting for? Let's start flipping 50.